The future of anti-aging medicine is broadening beyond traditional pharmaceuticals to embrace non-drug biotechnologies, innovative physical and immune-based therapies that promise to systematically rejuvenate tissues by clearing cellular debris and modulating inflammatory pathways. These approaches offer an exciting, complementary avenue to classic drug-based interventions, and early data suggests they could become mainstays of preventive and regenerative care. A prime example is low-intensity pulsed ultrasound, LIPUS, which has long been used clinically to accelerate bone healing, but is now emerging as a potential senolytic modality. Recent studies in animal models have revealed that LIPUS can selectively induce immune-mediated clearance of senescent cells by disrupting their membranes or modifying their microenvironment, effectively flagging them for removal by the innate immune system. Unlike systemic senolytic drugs, ultrasound can be focused precisely on problem areas, like arthritic joints or fibrotic lungs, minimizing off-target effects and reducing the risk of impairing beneficial senescent processes, such as wound repair. Given its safety profile, LIPUS could soon enter trials to test its ability to treat localized age-related dysfunction, and if successful, may offer a non-invasive, device-based option to rejuvenate tissues. On the immune front, perhaps the most radical advance is the development of vaccines or biologics that teach the body to recognize and eliminate aging cells. Inspired by the unprecedented success of mRNA vaccines in the COVID-19 pandemic, researchers are adapting this technology to encode antigens specific to markers of senescent or dysfunctional cells, like components of the senescence-associated secretory phenotype, SASP, or certain damage-associated molecular patterns, DAMPs. By inducing the immune system to mount a targeted response against these cells, RNA vaccines could enable a safe, systemic method to clear senescent burden without the need for continuous small molecule therapy. This approach effectively transforms the immune system into a perpetual maintenance crew, clearing age-damaged cells on an ongoing basis, an elegant, sustainable strategy that could profoundly slow or reverse many facets of aging. Beyond senescence, other immune modulation strategies are being designed to recalibrate age-skewed immune responses. For example, rejuvenating thymic function or reprogramming exhausted T cells could restore immune surveillance against cancers, infections, and senescent cell accumulation, addressing immune senescence, a root cause of frailty and multimorbidity. Similar interventions aim to suppress chronic, low-grade inflammation, inflammaging, by shifting immune cell phenotypes back to a youthful state, preventing tissue destruction and systemic metabolic dysfunction. In parallel, physical modalities like electromagnetic stimulation, photobiomodulation, and focused ultrasound are being explored to reduce neuroinflammation in the brain, a driver of cognitive decline and neurodegeneration. Early clinical studies suggest such techniques can modulate the blood-brain barrier, enhance microglial clearance of protein aggregates, and restore neuronal function, offering potential non-pharmacologic therapies for Alzheimer's and other dementias. Collectively, these strategies mark a profound shift toward treating aging not only with drugs but also with sophisticated devices and biologics that harness or direct the body's natural repair mechanisms. This integrated approach could enable doctors to offer personalized anti-aging regimens combining senolytic vaccines, periodic ultrasound sessions, and immune rejuvenation biologics, each tailored to a patient's biological age, tissue-specific vulnerabilities, and genetic risk factors. As validation studies confirm the safety and efficacy of these methods, future clinics may look dramatically different. Rather than simply prescribing pills, physicians could offer non-invasive treatments that proactively maintain tissue health, like a dental cleaning for your organs. Over time, these interventions could normalize the idea of periodic cellular maintenance, with patients undergoing immune-based senescent cell clearance or targeted ultrasound sessions as routinely as they get vaccines or checkups today. If these approaches fulfill their promise, they will not only extend health span but also democratize anti-aging care, offering less invasive, scalable, and potentially more affordable options than advanced gene or cell therapies. Together, non-drug biotechnologies could usher in an era of aging care that is proactive, personalized, and deeply integrated with the body's own healing systems, redefining what it means to stay youthful in the decades ahead.